Welcome to Let's Talk Jonesboro. Today we have two guests who are gracious enough to visit with us today. One is Carolina Elmore, and she is with El Centro Hispano. Hola, Carolina.
Hola, Bill.
And one is Bryan Castro, and Bryan is with the All of Us program. And now the All of Us program, first, Bryan, tell us a little about what that means.
Sure. So, like Bill said, my name is Bryan Castro. I'm from the National Alliance for Hispanic Health, and we're here in Jonesboro talking about the All of Us Research Program. It's a program from the National Institutes of Health, and the idea with this program is to really learn about our health throughout the whole nation, what makes us healthy, what makes us sick, taking into account our biology and our physiology, our behaviors, and our environment.
And you are partnering with El Centro Hispano. And I want to know, Carolina, what you guys provide for the All of Us program.
So first of all, the Hispanic Center is a nonprofit organization, and we work on improving the quality of life for the Hispanic community, but we do not refuse service to anyone in need. So we've been working with the All of Us research program for 4 years. We were approached by the program because the program wants everybody to participate, and minorities do not participate in programs like this. So we as Hispanics, we don't participate for different reasons, because we don't know, because the language barrier, because nobody invited us to participate in programs like that. And since all of us want minorities to participate, so we were approached for the program, and we've been working with them for 4 years, educating people about the program and what is important that they participate in a program like this.
And it's important to everyone because the real purpose of the All of Us program is to get, what did you tell me?
So the idea of the program is to gain more understanding about precision health.
And that means that when you go to the doctor's office and you have a runny nose, you aren't treated just like the person before you necessarily that came in with a runny nose. Explain a little more of that.
That's right. So another example would be like eyeglasses, for example. So if Carolina takes her eyeglasses and gives those to me, I probably won't be able to see through those eyeglasses because they're specifically prescribed for her. So something like that would be precision health.
And so it's taking the eyeglass concept to everything about your health care, and so that's the science, that's the future science that will make the difference.
Exactly. So people can sign up at joinallofus.org, share information about their health through surveys, through electronic health records, through wearable devices. If they have a Fitbit, they can even give a biosample. We have the journey here today at the public library, where people can sign up and provide biosample. And like you said, Bill, as we provide information, we can provide information about our health and better understand what makes us healthy or makes us sick. And as Carolina said, Latinos, we as a minority haven't been represented in research, but likewise, people from rural communities haven't been represented either. People with disability. There are other types of communities as well that haven't been represented.
Very nice. And you guys were here, or your all of Us van or truck or whatever it is. It was here several years ago, and I gave blood, but to get into this program and you're back. Is it to do the same thing, or are we at a different level now?
That's a great question, Bill. So the program launched participant enrollment in 2018. We're at the 5-year mark. The goal is to have 1 million or more people in the span of 10 years. We're about 640,000 participants so far, and the idea is really give anybody who wants to participate the opportunity to participate. There's been some new developments since the truck was here last time. And so if anybody's interested in learning more about those developments, we can definitely let them know at the stop if they visit us at the library.
That's wonderful. Carolina, where will the truck be at the library for a good while, or is it going to be at the Hispanic Center?
No, it's going to be at the library from Monday to Thursday from 10 a.m. to 4 p.m.
Will we be able to do anything after this week in Jonesboro?
So yes, people can join the program at joinallofus.org/TODOS, todos. This will allow people to join. the research program, consent to participating in the program, understanding what it is, what are the risks, what are the benefits in participating in a program like this, and also be able to create an account, have a platform, and be able to provide biosample at a lab. If they're not able to do it this week at the bus, they could go to a participating Quest lab, and their sample could benefit the program and knowledge of health, of our health as individuals, and in the future receive back information. And that's a little bit of what I was telling you about, kind of some of the new developments in the program.
Very nice. And Carolina, after this, after Bryan and everyone has left town, how do people continue to participate?
They can come to the Hispanic Center, and any of the ambassadors can help anybody with the registration part. And I just want to mention that it's very important that we Hispanics or everybody participate in this program, because medicine now is just one size fits all, and we are all different, and we shouldn't be treated medically as one.
That is very true. I've proved that a few times. Bryan, now tell me about the advance of the science. Tell me what we've learned in 5 years.
Sure. So since the last time we were here, the research hub is the data where all this information lives, the data from participants. Now, I want to make, before I go into talking about the development and the research, I want to make sure that anybody who provides information, whether it's a biosample, whether it's survey data, or their electronic health records, I want to make sure everybody knows that the data that lives in this data repository is de-identified. So people can't be identified by their name or date of birth. The data is protected. On the research end, since 2020, the research has been live. There are researchers conducting research studies already. There are 160 publications. If you want to look at cancer, if you want to look at eye health, there are studies already available where researchers have been able to publish those findings on those research findings. The other thing too is that as a thank you, the program is also providing information to participants, because this is an opportunity. This program is an opportunity not just for the research community and the scientific and healthcare provider community, but also for us to be able to learn about our health. So for people who give biosample, they can also receive genetic information as well.
What type of information?
Right. So a few years back, the program started providing information to individuals in terms of their ancestry. They also provided information, based on people's genes, if they might be sensitive to caffeine or if they might be lactose intolerant. Last December of 2022, the program started providing information to participants about their health. So there's 59 genes that are evaluated for each participant who gives a biosample that looks at those genes and provides that information back to the participant. This is separate from the research part. This is a thank you to the participants so that they know if there could be a finding for hereditary risk disease based on their genes, and also a drug-gene interaction based on 7 genes. I can tell you a little bit more about. I can expand if you want.
Go. Yeah.
So, I just wanted to add that along with that report, if there's any significant finding, there are genetic counseling services available, because this is related to health.
Right.
Ethically, the program deems that it's important to have genetic counselors available to help people understand if there's a finding, what does it mean, and then the program will pay for a diagnostic clinical test so they can kind of transition to a clinical team for follow-up.
Is there an age limit at either end of the spectrum that you want people to participate, like minimum age and maximum age?
Yeah, thank you for asking that, Bill. And just like Carolina said, all of us want to be able to participate in the program. There are some limitations currently. The people who can participate in the program have to be 18 or older. There's no cutoff on the age on the upper end, but yeah, at least adults right now.
Yeah.
We're looking to be able to expand that in the future, but hopefully next visit to Jonesboro, maybe we can have some pediatric participants, but adults for right now.
That's great.
Yeah.
That's great. So he's Bryan Castro with all of us, and she is Carolina Elmore from El Centro Hispano thank you, gracias, muchas gracias for
Gracias,
your
Bill.
your effort. And Bryan, thank you for
you so
all of
much.
us